Ar-Rahman Ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, everyone. Thank you for joining us today in this scientific webinar, which will be about carb counting with diabetes. It's my pleasure today to introduce our speaker, our clinical dietitian, Khadija Al-Amri. She graduated from Sultan Qaboos University. She completed her Master's of Science degree in nutrition. She worked as a clinical dietitian at Nizwa Hospital for 3 years. Currently, she is working at National Diabetes Endocrine Center for the last 11 to 12 years. She is specializing in diabetic carbohydrate counting, patients on insulin pump, obesity with different dietary approaches and strategies, pre and post bariatric for the patients with who had surgery for obesity. She has some publication in the field of nutrition. She is a speaker and non-speaker at national and international conferences. She participated also in writing some national guidelines, especially national diabetic guidelines and national obesity guideline. She is an active member in Oman Diabetes Association, and also for more than 12 years, and she worked as a board member. She is a member of National Task Force for weight reduction for school children aged between 7 to 8 years, and this is a project still going on. Today, our speaker, Khadija Al-Amri, will guide us through the essentials of carb counting, offering practical tips and strategies that can make a significant difference in managing diabetes and overall health. So, welcome with me, Khadija Al-Amri, in this scientific webinar, and she will give us a talk about carb counting with diabetes. Khadija, welcome, Khadija.
Thank you, Dr. Mariam. And thank you for inviting me to share the talk today about the important topic that the most people they ask to present it is about the carb counting. Actually, in the presentation, I will start the talk before going to the carb counting. I will start talking about medical nutrition therapy of diabetes, considering the carbohydrate, the glycemic index. Then I will move to something called nutrition care process, then basic carb counting, and last topic will be about the advanced carb counting, and I will present some case studies to make the view is clear. As all you know that diabetes is managed through many important parameters, which are the first is checking the blood glucose monitoring, balancing the nutrition food, carb counting for advanced people, taking medication, yoga, and exercise. And all those parameters are work together to manage the diabetes well. And also you know that the diet control is the first line to manage diabetes, even type 1 or type 2, and it is come with parallel with the other factors. As the statement of the American Dietetic Association, there is no one size fits all, so the nutrition recommendation has to be tailored to the individuals with a patient according to their like, dislike, medical comorbidities, current medication habit, living situation. So what that mean? That mean we cannot generalize any nutrition advice for all patients of diabetic. We have to tailor it based on the different situations, as I said. So the goal of the medical nutrition therapy, I summarize it into two goals. The first goal for the medical nutrition therapy is to achieve and maintain blood glucose level, lipid profile, blood pressure. And the second, to try to prevent or slow the rate of development of any chronic complication that related to diabetes. The medical nutrition therapy recommendation actually to monitor the carbohydrate intake of the patient, concern the glycemic index of the food or the meals, avoid any excess energy intake, especially for type 2 diabetes, and exercise to promote or maintain weight loss for patients who are obese. And the physical activity can help people with diabetes to achieve a variety of goals, including increased cardiorespiratory fitness, decrease insulin resistance, improve the lipid profile, and maintain a weight loss. And there are a lot of evidence-based guidelines you can go and recommendation for physical activity for diabetic patient and what's the best time to do exercise and how to to prevent any complication related to exercise. Also, I advise you to go through this guideline, a Canadian guideline. There is more details about how to monitor the glycemic control during the physical activity. But in general, you can summarize your advice for the diabetic patient to should accumulate of a minimum 150 minutes of moderate to vigorous intensity aerobic exercise each week, spread it over at least 3 days of a week with no more than 2 consecutive days without exercise, and sure including the children and elderly people with precautions. So now moving to the carbohydrate. When we say a medical nutrition therapy, why we talk about carbohydrate with diabetic patient? Why we don't talk about protein or fat or minerals or vitamins? We are considering something called carbohydrate. The carbohydrate are the main source of energy, give us a fast energy in our body, and has the most significant effect in our blood glucose, and less effect of protein and the least effect of fat. And what are the carbohydrates? Actually, the carbohydrates, they are starches, grains, starchy vegetables, fruits, milk, and dairy products, and other desserts and sweets. This is one of the divisions. It's divided by many ways, but this is one of the division of the carbohydrate, the starches. The starches like the pasta, rice, bread, and the others. The natural also divide the other division to natural sugar, which is found in fruits, dairy, and starchy vegetables like potato and others. The added sugar, which added in our desserts and sweets and drinks, and and the more is the intake of carbohydrate, is the more insulin is required. The other division is to simple and complex carbohydrate. The simple carbohydrate, which are the monosaccharides like glucose, fructose, galactose, which is found mainly in fruit and dairy, disaccharides, lactose, maltose, sucrose. The complex one like oligosaccharides like the legumes, beans, and polysaccharides like glycogen, starches, fibers, which are found mostly in green leafy vegetables. And the studies shows that the carbohydrate-restricted diet led to a remarkable reduction in A1C, HbA1c, and BMI for people who are obese, improvement of cholesterol, and also in children and adolescents with type 1 diabetes, the carb counting can reduce the hypoglycemia event and improve the quality of life, and seem to do some without influencing the body mass index. And the medical nutrition therapy, actually, it has to go through four steps. The first steps, I will go fast to here because we want to move to the carb counting. The first step is to do something called the assessment. The assessment to test the background information of the patient in order to know if this patient has any knowledge about diabetes, about carbohydrate, if they made dietitian before, if they had wrong information, so we can correct them. The second step to do identification and negotiation of the nutritional goals. So here we can teach a patient about the we can sit together with the patient, and if the patient willing to learn, if they want to go to carb counting or they don't want to go carb counting, they want to know only the basic things. The intervention is designed to achieve the individual goals, to do here a meal planning based on bolusing and insulin of the meals. And the fourth step is to do the evaluation. The evaluation actually coming in the follow-up. So we give a follow-up of the patient to test the knowledge and application of the intervention that we did with the patient, and to see any clinical outcomes if the postprandial blood glucose improve or not. So this is the steps of the nutrition assessment. It's ABCD. The A is for the anthropometric assessment. Actually, we take a weight, height, growth chart, blood pressure of the patient, the biochemical. We have to read the file to see the fasting blood glucose, postprandial blood glucose, lipid profile, protein, because all those will affect the meal plan. we have to see if the patient has protein in urine, has positive ketones. For high blood glucose, if they are having any ketones, that mean uncontrolled diabetes. If they have low blood glucose, so mean that the starvation ketosis. The D is for the dietary assessment. The dietary assessment is how to assess the diet of the patient by taking the diet history for typical days, weekend. So we ask a patient what you are eating on the last 24 hours. And so we have a general view about their intake. And we can use something called a food frequency table. Also, it's a helpful, and food diaries actually for the follow-up. And remember to include the full allergy intolerances, indulges, and binge eating in our assessment. So during the interview, also be mindful or try to not label a food as healthy and unhealthy. This is for a dietitian. Generally, don't say for a patient, this is healthy, this is not healthy, because it's not helpful to them. Try to go deep to the nutritional advice and tell them the amount and the exact amount that they have to take. If parents supposed to affect accuracy of statement, try to sit in a private interview with the patient. Actually, we face a lot of adolescents, so the parent maybe they behave uh, not that much good with their kids. So it's if you see that the patient want to see in privacy, want to see you in privacy, and want to talk more in privacy, so ask the parent politely so to sit in private interview. And get details also about the cooking method because it affects the glycemic index of the food. Ask about if they are adding oil on the food and other desserts they are adding to their foods, and also if they are taking food from restaurant and how frequency. Also, we have to know in the assessment, the lifestyle assessment, we have to know the occupation, active, sedentary, because it affects also the meal planning, schedule of work, study, because for student or for patients who are not daily at home, so different advices. Regular, irregular exercise pattern, frequency, duration, intensity, because also here you have to increase the protein or reduce it, depend on the intensity of the exercise. Now moving to something called the glycemic index. What's the glycemic index? It's reflect the magnitude of blood glucose rise for the first 2 hours following the ingestion of the food. So it has three ranking actually. It is a high, medium, and low. For example, if we say that this spaghetti has a glycemic index of 37, what does mean? That means 37 of percentage of spaghetti carbohydrate will turn into blood glucose in the first 2 hours, but the rest of carbohydrate that will turn to glucose in the next several hours. So is the more the glycemic, the higher the glycemic index is the bad or the more affecting the blood glucose fastly. So the glycemic index is affected by the method of cooking. The more food is cooked, so the more insulin, the more glycemic index, the higher glycemic index, the degree of cooking. Eating alone or combined with like protein, fat, and fiber. Because if you add any fat, protein, or fiber to that bread or rice, that sure will affect the glycemic index and will reduce it, the degree of processing. So attention to the highly processed carbohydrate food because it affects, and the effect of blood glucose differs individually. Some patients, maybe the bread will affect them different than the others. So try to individualize the advice. Monitor the blood glucose will give a patient a clear view about the specific food that will affect the blood glucose. So this is the ranking, what I said, the low, moderate, and high. The low is less than 55, 56 to 69 is the moderate, and more than 70 is the high. I bring this table from Krauss' book. I think most of the nutrition, they have this book. The glycemic index comparing with the two baked potato and apple, for example, because the apple, why it's lower in glycemic index? Because it is higher on fiber. So, and this graph will show you that The white bread, for example, it's high on glycemic index because it will be absorbed in our bloodstream very, very high. But while the legumes, for example, because the legumes has a fiber and has a protein, so the glycemic index will be low. So it will be absorbed within several hours. So in general, you can advise the patient to obtain the carbohydrate from a high fiber food like vegetables, high grains, and legumes. So this is the general advice that you can give. So now I will move to the basic carb counting. What mean a carb counting? It is determining how much insulin needed based to the carbohydrate intake. Why we do a carb count? Actually, to adjust the insulin doses based on carbohydrate consumption and give a patient more flexibility with eating. What that mean? That mean the insulin boluses of the meal will be not fixed, will be based on the carbohydrate intake of the patient. If the patient taking 30, for example, he need insulin less than when they are taking 60-gram carbohydrate. Who should learn the carb counting? All ages can learn all types of diabetes, the MDI, the multiple daily injection patients who are taking 3 insulin or more, the pump users, the pump trainers, diabetic nurses and educators, parents, school teachers for very young diabetics, catering persons in specialized centers. There are two levels of carb counting, the basic and advanced. What's the difference? So the basic one for type 2 diabetes with or without oral diabetic agent, and for people also starting recently the MDI, multiple daily injection. Actually, the basic will aim to give a consistent amount of carbohydrate at each meal at similar time each day. What does mean? Give a consistent amount. So, for example, give a 30-gram carbohydrate for breakfast, 30 for lunch, and 30 for dinner. This is a consistent amount. This is the basic carb count. And tell them a gram, and then you have to patient to be stick on that 30 gram and don't change it in every day. But the advanced one for MDI patient and who want to insert the pump, this is aiming to match the insulin they are taking based on the food. So they have to do a carb counting, insert the carb counting inside the pump, and then we'll give them a different bolus based on the carb, or who are on MDI. So we'll plan how much he want to take the carbohydrate. Then after that to do some math, then we'll get the units of insulin. So I will give you more case study on advanced one to be more familiar with it. So the advanced one would give them more flexibility. How? Because they can eat whatever they want. They can eat sweet, for example. They can eat carbohydrate more for مثلا special parties with an invitation they have or something. مثلا they can take, but يعني also watch the calorie intake. But also because they can take whatever they want and then they will engage the insulin. But also they have to make sure that not يعني don't do this is every time, because too much insulin it's not good for them. There are two counting methods, the carbohydrate exchange system and the carbohydrate gram method. Actually, the carbohydrate exchange system, what's mean here? So the one exchange mean it's a one serving size of carbohydrate, mean 15 gram of carbohydrate. So the one choice of carbohydrate equal 15 gram, like a one fruit, a one bread, 3/4 cup of cereal, like a one apple. So the starches, it has one serving of starches has how much? 15 gram, like a one slice of bread, half cup of mashed potato, half cup of corn, third cup of cooked pasta or rice or beans. The fruits has also, it's a high on carbohydrate. It has a 15 gram in each serving, like one small banana, half cup of juice, half of big banana, half of cup of cube melon, and half of fruit canned fruit or light or juice packet. The milk and yogurt, it contains 12 grams of carbohydrate, like a 1 cup. When we say a 1 cup, that means 250 ml. And 3/4 cup of yogurt and 1/3 cup of milk powder or 2 tablespoons of milk powder contain 12-gram carbohydrate. What about the vegetables? The vegetables contain low carbohydrate. It has only 5 grams. That in 1 cup of salad, 5 grams, and half cup of cooked vegetables has a 5 gram only. While the starchy vegetables like potato and other, it's like a starches, so it has 15. The zero carbohydrate are in proteins like meat, fish, poultry, egg, and cheese, and like condiments like mustard, mayonnaise, soy sauce, spices, herbs, artificial sweeteners, and sugar-free drinks all are zero in carbohydrate. We have something called zero or free foods. What means the free food? Any food less than 5 grams of carbohydrate in each serving, that we can call it a free food. For example, if you have little lettuce or tomato inside your sandwich, it's not a 1 cup, very little amount. So you can ignore that amount and you can say it is a zero. And butter, oils, avocado, olives, bacon, and cream, all those are free food. And in some food depend on the amount eating, like the nuts, peanuts, butter, seeds, ketchup, and salad, some salad dressing. This is depend on the amount because the nuts, it's not a zero, but if it's taking too much, it has some carbohydrate. Even some seeds and ketchup, because the ketchup, 1 tablespoon contain 2 grams. So if the patient take, مثلا, like 3 tablespoons and that meal, so it has 6, so maybe it will affect their blood sugar. So what the tools needed for the carb counting to do it in the clinical setting? So the tools actually using the measuring cup for liquid solids, measuring spoons, use a simple food scale, and relate the portion size to common plates and common used at home, and to show the patient and to do like eye measurements. Read and access the food packages with nutrition facts. So we have to have in our clinic like a food label packages and to practice with the patient. Check the handout if we have a carbohydrate exchange and serving list. Look to the for restaurants menu with the carbohydrate count. So some programs like and also, you can go to some website like a Carb Cups and Cals and Calorie King. This is we advise you to go through this website. It's helpful in carb counting. So this is the tools that what we have inside our clinic. We have a books. The patient can refer to them. We have a scale. We weigh for some patient. We admit them on the daycare and they bring their breakfast and lunch, for example. We have a food models to show the patient. We have a measuring cups. And this is also the website, and we show them how to log the food inside the website. And we have the food label, as I said, the plate. And this is some of the pictures that we are doing with the patient in clinical practice. And this table show you the differences between the tools, methods of teaching a basic carb counting. Here is the tools. If you use the pictures for the patient, the demonstration will be theoretical in our clinical setting. It's a time efficient and the patient benefit is moderate. While when we use a food model, the demonstration of the portion size in clinical setting, it is time efficient and the patient benefit is acceptable. But when you use a real food with the patient, it is showing them a real portion size and using the scale to show them the weight. So it is in clinical setting also can be done, and it is a time consuming, but the patient benefit is very high. So actually in our clinic, we practice all those tools. Also, you can use carb counting tips. It's a hand guides. Actually, if you don't have a measuring cup, go through this يعني to make it clear with the patient, a fist is like 1 cup, a palm is like so it show them the size of protein, the thumb to show them the size of cheese, for example, the handful it's for nuts and fruits, and the thumb for show them like a tablespoon or teaspoon. This table is summarize also the all what I mentioned before. This is the food group with the carbohydrate exchange يعني in gram, the serving size in gram, and the carbohydrate, protein, and fat. So we are only focusing on the carbohydrate. The bread, one side, if it's weight 30 gram, it has 15 gram. Half of it is weight, it's carbohydrate. Any bread and any bakeries, half of it is carbohydrate. If you want to use a scale, even the Arabic bread, if you want to put it in the scale, so if it's 30 gram in weight, so means that 15 gram. It's 40 means it's 20 gram carbohydrate. So the cereals, if it is half cup, 15 gram, potato half cup, 15, rice and potato third cup, 15. The fruits, one serving or one medium is 15. The fruit juice is half cup 15. The vegetable cooked half cup 5. The raw vegetable 1 cup 5. The milk, the 1 cup is 12. The yogurt 3/4 cup or 1 cup 12. The meat and fat are 0. So also this slide, I bring it to show you that we use it in to give them like a very easy thing for a patient, especially type 2 diabetes, is to tell them like to have to follow a healthy plate. Put your half of your plate is non-starchy vegetables, quarter of starches, and the other quarters of protein. The snacking, it's not a must anymore for the long versus rapid insulin, only for the GDM patient. And it's not, يعني, not all the patient, they have to take snack. And check the blood glucose to determine a need of insulin before taking that snack, and give them a healthier snack like fruit, dairy, nuts, and in combination. And try to negotiate with the patient if you want to take a snack high in protein and fat, healthy fat, that you may not need any insulin. And if you take a snack high in carbohydrate, it's more probably you will need a more insulin. So maybe you will take 4 insulin boluses on that day. So consider CGM for difficult patients to give them a safe allowance of snack and carbohydrate. Now I will move also to the insulin to carb ratio. I will stay more time here with the advanced carbohydrate. What's mean the insulin to carb ratio? Actually, the shortcut for it, ICR. It's the amount of insulin required to cover a given amount of carbohydrate. So the ratio will provide a general idea of how much of an insulin bolus that the patient can take when eating the carbohydrate. So for example, in this picture, if a patient want to take 1 apple, so he will need less insulin than when he want to take, or she want to take 3 apples. So what's the rule of ICR? Actually, it's dividing, putting this is a fixed number 500 and for adult and 450 for pediatric over the total daily dose of insulin. So you will sum all the insulin that the patient taking, the long and short acting. I will give you case study to make it more clear. So that will give you the ICR. Here is one of the examples. If we say that in the example that the ICR of this patient is 15, so what that mean? That mean every 15 gram carbohydrate, this patient, he will need 1 unit of insulin to cover that 15 gram of carbohydrate. That mean when he want to take one fruit for the snack, he will need one unit of insulin. So for the snacking, it's not advised to exceed a 15 gram on this case. It's not advised to exceed a 15 gram of carbohydrate. So you cannot generalize your advice in the snack. So if you tell them to take a 1 sandwich with a juice or with the milk, so this is not for all. So it depends on the ICR. If the total carbohydrate of this case is 90 grams, for example, of this patient taking 2 cups of rice, which equal 90 grams of carb, how we get the insulin for this 90 grams? By dividing the total gram of carbohydrate by what? By the ICR. Then you will get the units of insulin that the patient will need. So 90 gram over 15 is equal 6 units of insulin. So if the patient plan to take 2 cups of rice, first step is to do this math and do this calculation. Inject the 6 units of insulin, then we'll take the rice safely without rising the blood glucose. The other example, if a patient ICR is 10, what that means, every 10 gram of carbohydrate, he will need 1 unit of insulin to cover that 10 gram of carbohydrate. And for example, if the same example, if this patient taking 2 cups of rice on that lunch, for example, how much units of insulin will need? So because the ICR here is lower than the case before, so the units of insulin will be increased. So 90 over 10 will equal 9. So we'll take 9 units of insulin, then he will take his lunch. So if the patient come in the follow-up and has postprandial blood glucose, so we have to review the food dialogue or the food record sheet that the patient will bring. So if we will check the carb counting. If the carb counting is good, so maybe we'll go to reduce the ICR. The other thing in the advanced carb counting too, to measure or you have to know how much the ISF or insulin sensitivity factor of patient is. Actually, it's different from 1 to 1. It is estimated the drop of in a person blood glucose unit of insulin over 2 to 4 hours period. It's using for correction, taking a correction dose of insulin. Actually, we use this information to get the insulin sensitivity factor. This is the standard number or a fixed number, 100 over the total daily dose or total insulin dose. So how to apply the correction factor? Actually, to have a blood glucose before dinner, if the blood glucose before a dinner is 18, for example, and the ISF of this patient is 2, so how to get the correction dose? The first step is to minus the target from the actual blood glucose. So if the actual blood glucose is 18 and the target of this patient is 9, for example, so you will get a number, then you will divide it by the ISF2. So this is the correction dose. This is the correction dose. I will repeat it again. How to get the correction dose of the patient? As to minus the target blood glucose from the actual blood glucose, then divided by the ISF that you have. So the ISF is 2, so 9 over 2, 4.5. And we'll use a midpoint of this number because the patient cannot take 4.5 by the pen. So if the patient has more hypos reading, so we'll take 5. If the patient has more hypers reading blood glucose, we'll take 5 units. This is one of the case study that make the previous thing more clear. For example, this patient is 26 years old male. He is a newly diagnosed with type 1 diabetes on MDI, taking Lispro 8 units TID and Lantus 16 units. The A1C at diagnosed was 12 and referred from the endocrine doctors for carb counting. The first step is to measure the ICR. It's calculated actually by the doctor, and here is the method. The ICR 500 over total insulin dose or total daily dose. The total daily dose for this patient is 40. 500 over 40 equal 12. What means by 12? Every 12 gram of carbohydrate, this patient will need 1 unit of insulin to cover it. Here is the example. The second step, if after teaching the patient the session of carb counting, we have to give them something called a food record sheet for 3 to 4 days, and then come for follow-up to check the diet record sheet. For example, this patient taking 2 Lebanese bread, medium size, had 30 gram carbohydrate, 1 boiled egg, 0, 2 teaspoon cream cheese, 0, 1 cup of tea without sugar is 0. So the total carbohydrate on that meal is 30, but his pre-blood glucose pre-breakfast 12, the fasting, and the post is 18. So how much insulin that this patient will need? And his ICR is 12. So we'll divide the 30 over the 12, the total gram of carbohydrate by the ICR to get the units of insulin. But this unit of insulin is not enough. It's not enough to taking 2 units because he has a high blood glucose pre-meal, so he will need more insulin for something called a correction dose. So the correction dose, how to get it? First, how to get the ISF 100 over total daily dose, like 100 over 40, which mean 2. So what's mean by 2? Every increase of blood glucose by 2 millimole will need 1 unit to drop it or to correct it. So if it's the normal 8 and the patient blood glucose 10, so he will need 1 unit to correct it. If it is 12, he will need 2 units to correct it. So every 2 millimole higher, he will need 1 unit to correct it. So actually, we use in our pediatric department this scale method to make it easier for the patient, rather than using the actual minus target over the ISF, using the scaling method to make it easy for the patient. So the diabetic educator, she will tell the patient if blood glucose higher than 8, you will need one unit of insulin. If it's higher than 10, you will need 2 units. If higher than 12, you will need 3 units. And if you're higher than 16, you will need 4 units to correct for correction. So this example, what we have it, so the total dose of insulin, so insulin for carbohydrate plus the insulin needed for high blood glucose. So 2 units for the carbohydrate and 2 units for increasing the blood glucose. So this patient, he will need 4 units of insulin. So this patient here, he will take the 4 units of insulin, then he will take this food and for in the future, so the blood glucose will be better. And this is all what I have today. If you want, I keep more time for the discussion. I'm sure there will be a discussion. So if you have any question, another the time for the questions, Dr. Maria.
Thank you very much, Khadija, for your enlightening presentation. I think you have provided us a lot of information, a lot of knowledge, a deeper understanding for carb counting. Cannot see any question for time being, but I have some questions, maybe related to glycemic index, because we are, as a doctor, sometimes as a dietitian, we may confuse ourselves. What does it mean, glycemic index? So can you just emphasize more what is glycemic index and how you advise the parents to tell them this is low or medium or high glycemic index?
Okay, it's a good question. Also, we have a question in the clinic a lot from many parents who are well educated about this one. So actually, the glycemic index is very important, but in carb counting, and why we do a carb counting or patient with insulin pump, they have to focus on the gram, not on the glycemic index. But if they focused in both in the grams and glycemic index, the blood glucose profile will be much better, and their quality of life will be better. So they will not come hungry every time, and they're taking insulin frequently. So I will make it more clear. we have low glycemic index, medium, and high. So we don't advise a patient to take any high glycemic index. The high glycemic index, anything has more sugar, more simple sugar, like مثلا the sweets, dessert, juices, all those are high glycemic index. The honey, for example, jam, condensed milk, for example, this is high glycemic index. Anything has added sugar, it's high in glycemic index. But the bread, rice, it's not high on glycemic index, but it's high on carbohydrate again. So if you have a food high on carbohydrate and you want, or high on glycemic index, but you want to make the glycemic index low, try to combine on that meal protein, healthy fat, and fiber. I will give you example. مثلا, if the patient, you have to advise them not to take مثلا Omani bread with tea, or this is shabura ولا شو اسمه هذا dry toast. They
Yes.
take it usually with tea
Yes.
at the morning. So this is high glycemic index will be, they will come, they will be hungry very fast. So try to what? Because the tea has sugar. So try to mix with that breakfast, something from protein source, like what? Like an egg or any healthy cheese, like halloum, cottage cheese, cheddar cheese, and any unsalted cheese. It's very good to start with, or any proteins, and also healthy fat like olives, like little nuts to start with the day or that on that meal. So if you want to make the glycemic index low, try to combine the protein, like I said, egg, like chicken more on that meal, fish more on that meal. So that will reduce the glycemic index. And try to increase the fiber from what? From the seeds. مثلا quinoa seeds and other seeds, put it inside the salad, make the green leafy vegetables more on that meal. So that will also lowering the glycemic index of that meal. So it's good for the patient to have a knowledge about the carb counting grams and also about the glycemic index. And the glycemic index, they don't have to know numbers. They don't, and they don't have to have a numbers or memorize the numbers of glycemic index, because the glycemic index of that food will be differ depend on the cooking, as I said, depend on the if you add anything, if it's processing. And in general, also, you have to advise your patient as a doctor, try to not take any processed food or يعني like chips or biscuits, هذه الأشياء. Anything processed in the factory معناتها it's high on glycemic index.
Okay. Thank you very
The
much.
more is processing and the more is that food cooked is the more is the glycemic index. For example, also I can give the rice. If it's cooked
Okay.
very well and مثلا very long cooked, يعني مثلا like العرسية or for example, it's higher on glycemic index than مثلا الريس إذا كان it's not well cooked, يعني not too much cooked.
Okay, thank you, Khadija. Khadija, questions are coming here because we have around maybe 20 minutes or 15 minutes. This is a questions, this is a type 1 diabetes. For example, she's giving an example, a cup of cappuccino, how much it's needed? And it's always better to use low fat, skimmed milk, or full fat. So
Yeah.
she's asking a cup of cappuccino, how many, I think, carbs
أيوة.
on it, and which is better to
Yeah.
use low fat or skimmed milk, full fat.
The cappuccino actually is better to use, it's not, there is no difference between low skimmed or full fat, because all they are the same carbohydrate. The difference on the fat, and the fat is zero carbohydrate. So in the carb counting and for insulin, it's no need يعني to you, it's no different between the low skimmed and full fat. So and in generally, we advise to use, if that patient, he don't want to take bolus for that cappuccino, مثلا he don't want to inject insulin for that cappuccino, so better to take a plant milk, like what? Almond milk, soya milk, coconut milk. This is all zero carbohydrate. But if they plan to take like animal milk مثلا or powder milk, they have to count it. In 1 cup of milk contain 12 gram carbohydrate. And how much insulin? The example, how many units will need, no, it's depend on the on the ICR the patient they have. It's depend from 1 to 1. If مثلا ICR of this patient is 15 and he take مثلا 1 cup of milk with 2 tablespoons of sugar, actually he will need insulin for that cappuccino. If he's taking stevia with plant milk, so he will not need insulin.
Okay, clear. I think someone want to speak or to give us a comment or something. Kauthar? I'm not sure if she... Kauthar Al-Abri. She want to talk?
Welcome.
I think someone raised hands. Kauthar Al-Abri.
Maybe by rank.
I'm not sure. I think Kauthar, are you around? I think we'll take the question, and if she will come back, we'll take her comments.
Okay.
This is Ahlam. She's asking if the patient took milk tea without sugar, is the milk added will be counted or not as a carb?
Yes, sure, will be counted. It will be counted if it's a butter milk, but condensed milk, because most of the condensed milk we have, has the carbohydrate in whole bottle 6 grams. Some of them like 5 or 4. So they will not take a whole condensed milk, اللي هو الحليب المبخر. لا, so they will not count it. If it's without sugar, they will not count it by condensed milk. If it's by a powder milk, sure, they will have to count it. So give estimation, like 1 cup, 120 ml, give it by 5. Then you have to do a follow-up with the patient. Still the blood glucose postprandial high, increase that cup to 10.
So it depends on the milk.
It depends on the type of the milk.
Type of the milk.
If it's a plant milk, as I said, like almond, coconut, or مثلا soya milk, any plant milk will be 0. So no need to count it.
Okay, good. For type 2 diabetes, does a fruit better to take it in between meals or with meals? For type 2 diabetes.
Actually, it's depend from 1 to 1. We have to assess the patient individually, but in general, they can take it between if they want, but they have also to see the blood glucose. يعني this is a SMBG. If the blood glucose pre-meals will come high, so I mean they have to put it with the meal and take it with the insulin. So try to stop the fruit if it's if that fruit cause for them a high blood glucose pre-meals, or if it's good also to combine the fruit with some nuts to reduce the glycemic index of that fruit and make it not causing the high blood glucose pre-meal.
Okay, thank you. Another question, how do you adjust the ICR?
Actually, the ICR, it's calculated by the doctor. It has a rule, standard rule, 500 over total daily dose of insulin. The total daily dose, you have to sum all the insulin patient taking, the short acting and long acting. So 500 over total daily dose, you will get the ICR.
Okay, so there is a calculation should be done by a doctor.
By the doctor.
With the collaboration with you and the dietitian and educators. There's a questions also from Bisma. Is stevia the sugar is safe to be used for diabetic patient?
It is safe. It's FDA approved and it is safe.
Okay. Is there any types in the market for the types of stevia? Because patients usually asking, there are a lot of types of stevia.
Yeah.
I'm not sure.
Different types. The stevia, by its name, it is safe, but something called steviana. Steviana actually is combined other sugar alcohol. It has like, I'm not sure about the name, erythritol or something. And that maybe it will affect the blood glucose because the sugar alcohol has little effect on blood glucose. But the stevia itself, no, it will not affect the blood glucose.
Thank you.
But the other branches like steviana, that's
Yes.
it, يعني maybe it will affect the blood glucose.
Okay, so they have to make sure before buying
Mm.
stevia what type of stevia and what is
أيوة.
the content on it.
Yeah, they can ask the professionals and they send us مثلا the picture so that we can tell them if this is the good one or not. And in general, if the patient can stop the added sugar at all, it's better. We are not advised. But if they cannot stop and take little stevia, it is FDA approved and they can take it safely.
Thank you. This is Khadija. This is, I think, a mother asking
Mhm.
about her daughter. She has a high glycated hemoglobin. That means
Mhm.
maybe fully controlled, but she likes juices as usual. Children, they like juice. So, which juices and type of fruits can be used?
Okay. The juices actually that has zero carbohydrate, it's lemon mint juice with stevia. مثلا هو avocado juice.
Mhm.
But use inside the avocado juice, as I said, a plant milk like coconut or almond milk. If يعني it's not acceptable مثلا for her مثلا try to use مثلا little اللي هي الكريم مثلا whipping cream little and with stevia. So make the avocado with cream or with the plant milk with the stevia or lemon mint. The other thing is the berries. The berries has a carbohydrate but يعني the glycemic index low. So مثلا you can give her like a strawberry or like that with also with stevia.
Okay, thank you, Clear.
Mhm.
This is a question: which is better to take, lemon or milk?
Actually, the leaven is less carbohydrate than the milk usually
Yes.
because it's diluted
Mhm.
and it depends on the label and مثلا they have to check the food label. The less carbohydrate is the better for them. And as again, I will repeat, if they take a plant milk, is zero carbohydrate.
Okay. This is a thanking message for you, Khadija, for your effort,
Welcome.
for the excellent presentation. This is another. Bisma is asking again: is it true that when woman is first week before the period, before getting her period, she need to
Mhm.
increase the basal
Yeah.
insulin higher because I always seem higher even if eating the same.
Mhm.
I think she is on a type of
Um,
insulin pump only.
مثلا, yeah, maybe she is type 1. Yeah,
Type 1.
usually in their period, yeah, they are taking more insulin. Even if they have a bump, they have other pattern for period time and other pattern for normal days.
Yeah.
Actually, not for all. It depends from patient to patient. If she notice that having this is, she has to refer to her physician, her doctor, and they will advise if she has to take to increase the basal or increase the boluses also.
Yes, clear. But Basma, we
Yeah.
advise you to
Better,
contact
yeah, to
and
refer to her physician.
you go to your physician better because this needs to be adjusted, especially if the patient's on insulin pumps.
Yes.
Aisha, she is commenting here that actually there is no stevia in most supermarket. I'm not sure where is this
What
available.
to do with them? I think it's available. She has to search
Yes, we are not doing
carefully.
يعني
Mhm.
we are not doing advertisement for any any supermarkets, but I think most of the supermarkets
Yeah.
there's like a space or a branch little bit
Mhm.
talking about healthy food.
Even the pharmacies.
Yes,
The
true.
pharmacy, there is stevia and other sweeteners.
Yes. This is a question, I think it's related to the dates and types of the dates. Is there any
Mm.
difference in the carb content?
Oh, yeah, usually we answer this question many times. Um, Actually, the dates, there is a study also done by one of the prof doctor. He is from Al Bahrain and he compared different dates in Oman. He bring most of the dates and he found there is a very minimal differences between the different types of diet. So in general, there is no different. It depends on the weight of that diet or the size. If it is medium size, or if you put it inside the scale, it's 30 gram, it's equal 15 gram carbohydrate.
Mhm.
So it depends on the size of that diet.
On the size, not on the
Yeah,
content.
or not on the type.
Because you know, the message usually it's there are
Yeah,
some
خلاص, and other.
types of dates.
Yeah,
They are too much.
no, it's not depend on the sweet taste on our tongue, because the bread and others, they are not sweety, but they are high in carbohydrate. So by the same theory, it's not depend on the taste. It's depend on the starches what they have.
Yes, there are also thank you messages for you, Khadija. This
Okay.
really was very nice presentation. I think we have 2 minutes, and then for more 2 questions. Someone said, there is a question, someone said that the body get used to stevia where it will start treating it as the normal sugar. Is that true?
I don't understand this
That
question.
means she's asking that if the patient get used to using the stevia sugar, the
Oh,
body
I know.
reflect that stevia as a normal sugar in their body.
There is many studies on that stevia now. Also, but it is FDA approved. If we said FDA approved, that means long studies and a lot of very long period of time they did a study on it. Then they say it is approved. But now the new studies coming. Yeah, maybe the body it will send a signal that you have a sugar, and you will if you take anything has a stevia, you will increase your hunger hormone and that other. But in general, you can prevent this one by what? Don't take it alone. مثلا, if you want to take something with stevia, try to take little nuts with that, مثلا cup of tea or cup of, مثلا if you want to take a stevia in your morning breakfast, try to take egg. So the egg will what? Will stop that sense that you need more sugar or the hunger hormone. Even if you want to take a cappuccino for a snack and you put a stevia inside it, take little nuts like 5 مثلا almonds, like for example, will prevent this one.
Okay. I think before taking stevia, and there are a lot of brands now of stevia in supermarkets, I advise the patients, the parents to contact the dietitian before giving this stevia to children also.
Yes.
But they need to understand there's a lot of brands, a lot of advertisement for other types of sugars. So we advise them really to contact your dietitian in the hospital, and I'm sure they will give you advices for types, and actually they will ask for bringing that leaflet for stevia, and they will explain to them.
صحيح, sure.
I think we can end now. No more questions. I cannot see any more questions. If you have more questions, you can share it with the Oman Diabetes Association. Will be asked privately to Khadija Al-Amri, and will give you the answer as soon as possible. So really, we thank you again, Khadija, for appreciating your time and efforts and sharing with us the excellent presentation and the deeper understanding of carbohydrate counting we got it from you. Thank you very much.
Welcome, Victoria, and thank you. Thank you very much.
And before we close, really, we would like to extend our thanks also to Oman Diabetes Association for their outstanding organization at this event, especially organizing by Saud. And thank you very much for him. And also thank you for you all for your participation and engagement and thoughts we got from the participant here in the chats. And thank you for and we have all the best for the people and diabetic patients. And for more questions, you can just raise it to Oman Diabetes Association. You will get answer as soon as possible. Thank you very much and good night.
Thank you. Good night.